Thank you very much. I'm Tesfamichael G.Mariam from University of Nursing, Department of Surgical Nursing. My title is the effect of fear and knowledge of COVID-19 on preventive practice among pregnant women who attend antenatal care in Northwest Ethiopia, 2020, an institutional-based cross-sectional study. Here is some of my presentation outline: introduction, justification, objective, method, result, discussion and limitation, conclusion, as well as reference. When we come to the introduction part, the novel coronavirus disease 2019 pandemic has infected over 1 million individuals with almost 50,000 deaths worldwide as of December 19. Currently in Ethiopia, more than 2,000 deaths was happened. And COVID-19 is currently a global health threat and a public health emergency. And urgent questions that need to be answered timely, and this include whether pregnant women are highly compromised by the policy and the strategy for highly affected by the fear of COVID, acquiring the disease. Therefore, this study aimed to assess the effect of fear on preventive practice. This is a justification. There is one of the justification for conducting this study is there is limited evidence that shows the current status of fear and knowledge of COVID-19 on preventive practice of pregnant women. Nowadays, it is a global concern. When we come to the objectives, general objective to assess the effect of fear, knowledge of COVID-19 on preventive practice among pregnant women who attend antenatal care in Gondar town, Northwest Ethiopia. Specific objective to determine fear of COVID-19 among pregnant women and to determine knowledge of COVID-19 among pregnant women. And the other specific objective is to determine practice of COVID-19 among pregnant women and to determine fear associated with preventive practice of COVID-19 among pregnant women. Here is a method, a study design and period. It is an institutional-based cross-sectional study was conducted from July 01 to August 30, 2020. The study setting. The study was conducted in Gondar town. Gondar town is located 760 kilometers from Addis Ababa, capital city of Ethiopia. Currently, there are 6 public health facilities in Gondar town, and from all those public health facilities, 2001 pregnant women had got ANC service from the report of the preceding 3 months. When we come to the population, source population, all pregnant women attending antenatal care service in public health facility of Gondar town. Study population, all pregnant women attending antenatal public health facility of Gondar town during the study period. Inclusion criteria, all pregnant women who were attending antenatal care service in selected public health facility of Gondar town during the study period were included in the study. Exclusion criteria, pregnant women who were seriously ill and unable to communicate throughout the study period were excluded. Sample size determination and procedure. the single population proportion formula was used to determine sample size by considering the following statistical assumption, which is 50% of 50% proportion, because there was no study conducted in a study area, 95% confidence interval with 5% of margin of error was assumed. And then after adding a 10% of non-response rate, the final sample size was 422. Finally, participants were proportionally allocated to the 6 health facilities in town based on the number of pregnant women who visit each health facilities. And a systematic random sampling technique was used to select the study participants. After K is calculated using N over N, and then finally a lottery method was applied to determine the starting point. Study variables, depending variables, preventive practice of and that variable, socio-demographic variable, such as age, gravidity, parity, ANC visits and residency, marital status, religion, ethnicity, and her and her husband educational status and family monthly income is incorporated as socio-demographic characteristics. Fear and knowledge is an independent variables. Operational definition, good knowledge of COVID-19, which is participants who scored the mean and above 13.93 on the knowledge questions. Poor knowledge, patients who score below the mean on knowledge question have fear towards COVID-19. Participants who score the mean and above on fear question have no fear towards COVID-19. 3.68% on fear question. Good preventive practice of COVID-19. Participants who score the mean and above 7.69 on preventive practice. Poor preventive practice towards COVID-19. Participants who scored below the mean, 7.69 on practice items. Data collection tool and procedure. Data was collected by using pre-test face-to-face interview question with 1 meter distance in between interviewer and reviewer. The questionnaire includes socio-demographic characteristics, fear-related and knowledge-related, and practice assessment questions. Data quality assurance, 1-day training was given for both data collector and supervisors, and pre-test was done on 5% of the sample size in the study area, which is 21 questionnaires. Data collection was supervised, and statistical analysis, all the data was checked and visualized, and then it was added and entered into EP-Info version 7, and it was exported to SPSS version 22 for analysis. Frequency, percentage, and summary statistics like mean and standard deviation were examined to describe the data, and binary logistic regression was run, then variable with p-value less than 0.01 again enter into multivariate logistic regression. Finally, significant factors were identified based on the adjusted odds ratio, which include 95% confidence level at p-value less than 0.05. From ethical review committee of the School of Nursing on behalf of Industrial Review Board of University of Gondar, written consent was obtained after informing them about the purpose, the benefit, and the confidentiality of information and the voluntary nature of participants in the study. Here is a result, socio-demographic characteristics. A total of 421 pregnant women with a response rate of 100% participated in the study. More than half of the respondents were aged 26 up to 35 years with a mean age of 27.56 with a standard deviation of 5.03. years, the majority of respondents were Orthodox Christian, which is 73.7%. 9.2% were urban residency, 89.8% were from Amhara region, 50.9% and 10.4% of the mothers were unable to read and write. And out of those could read and write, 60.1%, 10.4%, and 24.6% had primary, secondary, diploma, and above education, respectively. The rest one is listed on the table 1. When it comes to the obstetric characteristics of respondents, most of the participants were gravida 1, which is 35.1%, and 32.9% of the participants were gravida 2, while only 21% of 21.3% and 10% were gravida 3 and 4 respectively. In terms of parity, 37.0% were para 0, 32.5% was para 1, and 20.6% were para 2, and 8.3% were 3, para 3, and 1.7% is greater than 3. Parity. The rest one is listed on the table 2. Fear, knowledge, and preventive practice related characteristics of respondents. Half of the respondents have fear of COVID-19, which is 50.9%, and 55% had good knowledge of COVID-19. 47.4% of them have good preventive practice towards COVID-19. The rest one is listed on the table 3. And then factors associated with preventive practice of COVID-19. Those who had good knowledge were 2.3 times more likely to have good preventive practice than their counterpart, and the respondents who had fear were about to have good preventive practice than their counterpart. In this study, when we come to the discussion, in this study, out of the total 4.4% had good preventive practice for COVID-19. This finding in line with the study done in G.Mariam, and it is higher than those study done in Thailand. The preventive practice of COVID-19 in this study is, however, much lower when compared to the study done in Iran and China, which is 89% of the participants practiced preventive practice of COVID-19. The underlying reason for this difference could be the period and the place in which the study were conducted. The majority of the respondents, 55%, had good knowledge of preventive practice. This finding is in line with the study done in educated Ethiopian, in which 52.2% had good knowledge. The result of current study regarding respondents' knowledge is also paired with the study done in Thailand, which is 26.6%. The result of this study are also higher compared with the study done in G.Mariam. This could be the possible reason might be due to difference in level of information regarding COVID-19. In the current study, respondents' knowledge and fear were significantly associated with preventive practice of COVID-19. Those who have good knowledge were 2.3 times more likely to have good preventive practice as compared with the counterpart. This finding is consistent with the study done among educated Ethiopians. Showed that pregnant women had fear for COVID-19 were about 2.5 times more likely to have good preventive practice than counterparts. These findings agrees with those of studies done in Iran and Taiwan. This could be due to people who fear to acquire and transmit the disease could take care of themselves and better comply with preventive recommendation. Limitation, as in any cross-sectional study, cause and effect relationship was not possible to establish for the factor dealt in the study, and in addition, shortage of similar study carried out in the Ethiopian has limited comparison and discussion of the results. Conclusion and recommendation: only half of the pregnant women had good preventive practice. The findings suggest the healthcare providers and stakeholders should consider these findings to develop a strategy on preventive practice against COVID-19. Acknowledgement, I acknowledge for University of Gondar and as well as for participants for giving their consents. Here is reference, some references. Thank you for your attention. This is all about